More than 2 years after the BP oil spill, researchers are still trying to address the environmental, economic, and emotional health concerns in Gulf communities since the spill. With PI Center Director Tracy Irani moderating, researchers met with people affected by the spill in Gainesville, Apalachicola, Cantonment, and Santa Rosa Beach, using a video link to connect the meetings simultaneously. In Apalachicola, community leaders discussed the strengths and weaknesses of how the emergency was addressed and communicated locally.
The mainstay of disaster management is always all disasters are local. And I believe that was one of the weaknesses we have, that we had lost that thought of all disasters are local.
You destroyed the typical person who's getting maybe information off the TV. You destroyed their trust and ruined credibility. So it's very, very important, out of the box, make sure that you get the message right.
It's also very important that you try to learn the language of the individuals that you're working with and not expect them to learn your language. And that's what happens so often also, especially in rural communities. The experts come in from outside and they have all of their tables and charts.
What we were missing was local control of resources, because we had other people who were not part of our community telling us how to apply funding.
UF Emerging Pathogens Institute Director Glenn Morris is the principal investigator of a grant that is part of a 5-year, $25 million program that includes the University of Florida and 3 other universities. He said the oil had a profound impact on Gulf communities well beyond where the oil reached the shores.
We're talking oil spill, but we're also talking about ways in which we can work together with communities, and communities can recognize how they can better respond to disasters. I think one of the things that we have come to realize is that there were profound impacts on Gulf communities that went well beyond areas where there was actual oil involved. There were significant financial impacts and in turn psychological impacts. And so when we look at overall community response, we need to go beyond just those areas where there